In today's show, let's talk about the Yale LISTEN study, which is a very interesting long-term follow-up study from individuals who have received illness from the thing that was supposedly safe and effective. We're also going to talk about why this year's cold and flu season is one of the worst in recent memory. Here is a figure from the CDC showing total hospitalizations for influenza-like illness during various different seasons over the past 10 years. And you might be surprised to learn that the 2024-2025 hospitalizations is pushing over 800,000. Now, this was data from last week as we filmed this on the 21st of February. We don't have statistics for this week, but I'm sure you know in your workplace, in your school, in your peer group, it seems like everyone's sick. Like it's kind of crazy, right? Like everyone is sick, and not just kind of sick, like really, really sick. So we have 5 possible scenarios I'll share with you on the screen. Let's talk about why. I mean, this is what science is about, is asking critically important questions, but I feel as though, I don't want to spoil it, but I have a hunch as to why so many people are sick, and I could be totally wrong on this, but here's 5 scenarios as to why we have one of the worst cold and flu seasons in recent memory. Okay, now remember, more people are dying from influenza-like illness this season compared to COVID-19. This is the first year since 2019 that has been the case. Okay, so possible scenario number 1, we are better at detecting and testing for the flu. Right? That could be it. Remember when, it used to be 1 in 50 children were diagnosed with autism. Now it's 1 in 36, then 1 in 32. Everyone said, well, autism has always been around. The rate is not increased. We are just better at detecting autism. That's what a lot of people have said for a long time. Okay, fine, sure. That wasn't the case with autism. That could be one reason why we're seeing so much influenza-like illness. We're just way better at detecting it because people were sort of normalized to test for COVID when they were sick, the last 4 years. So they're going to the hospital and stuff and getting the influenza test. Okay, that could be true. Possible scenario number 2, this influenza strain is much more virulent compared to years past. Could it be that bird flu is now causing influenza-like illness and is going undetected? There's some people speculating that could be the case, that the avian influenza has now mutated. It's now not only affecting birds and pigs and cows, it's affecting humans, and it's really virulent, right? So that could be true. That's possible scenario number 2. Possible scenario number 3 is we are just less healthy as a result of pandemic lockdowns and gym closures and stay home orders and all of that. And people have just, not returned to their normal habits, and they are just normalized to eating more junk food and ordering everything off Uber Eats or Instacart, and are, doing more and more work from home. Although that has shifted in the last literally months, where Amazon and Facebook and tech companies are now mandating people come back to work full time. So that could be part of it. And I think ultimately, when we look at this, it's going to be all of these factors coming together. Okay. Number 4, this is what the media says. Not enough people have got their flu shots. There is like this vaccine hesitancy. Our public health apparatus seems to be sort of monomaniacally focused on this vaccine hesitancy. And so, when this Yale report that we talk about here, this Yale LISTEN report, highlights that, wow, some people, not everyone, but some people who received the S protein based immunizations, they have unintended harms. Who knew, right? It was supposedly safe and effective, but for some people it's not, right? It seems that our public health apparatus is really focused on one thing and one thing only, and that is vaccine, the widespread implementation of vaccines of all sorts, especially the influenza-like vaccine. And so that's what they say. Not enough people are getting the flu shot. Okay, well, that could be true, but I don't know about you. I feel like the people that really drank the COVID Kool-Aid are all about getting their flu shots now. In fact, they get the flu shot with the COVID shot. I mean, this has been promoted for the past 2 years. So maybe that's the case, maybe not. Now, the 5th possible scenario that I've come up with is that people's immune system is burnt out from repeated inoculation with the S protein containing immunizations, which leads us to this new Yale report, because it turns out that the spike protein is the most virulent of all of the proteins on SARS-CoV-2, right? There's O proteins, there's the nucleocapsid, there's membrane proteins, but the S protein, it turns out, can initiate an autoimmune-like phenomenon in people when they get the virus or they actually get the inoculation. And many of us, this is not conspiracy theory at all. Many of us know that the mechanism of action of the mRNA-based vaccines is you are telling your own cells to make a protein that they don't normally make in the human body, and that is the spike protein. That spike protein enables SARS-CoV-2 to hijack your own cells and replicate and give you an infection. That's the mechanism of action of how the SARS-CoV-2 virus causes influenza-like symptoms and upper respiratory distress and so forth. Well, that is the sole mechanism of how these immunizations work, is by causing your cells to make this, it turns out, highly inflammatory protein. And this new Yale LISTEN report has found that some people have immune exhaustion as a function of that. Not everyone. People, generally what they found, and I'm going to get into this shortly, and I really don't want this to be a big conspiracy type video. I'm just asking questions. I think we should all be asking questions. And it's really peculiar why we are seeing so many people sick around us and so many hospitalizations from the flu. And this is what the media is talking about. So I think it's a combination of all these 5 factors, but I think, from henceforth, where I would like this video to go is to ask a really important question is, could people's immune systems be functionally exhausted as a consequence of receiving numerous immunizations that are based upon this spike protein delivery system? That's not to say that, there was any nefarious intent in making the vaccines, nothing like that. It's not an anti-vaccine video. It's just, let's just talk about what could be one reason why many people are sick. And it has to do with this report. The title of this preprint, you can check it out on the web, okay? It's not on QAnonconspiracies.com. It's right on MedRevix. The title of this analysis is Immunological and Antigenic Signatures Associated with Chronic Illnesses After COVID-19 Immunization. There's a lot of public health individuals here that work for Yale University School of Medicine. So again, this is not conspiracy, not anti-vaccine conspiracies at all. These are people who are very curious to know, why is that a fraction of the individuals who get immunized, why do they have what's known as post-vaccination syndrome? And they looked at various aspects of the immune system, cytokines, different CD4 T cell subsets. There's all sorts of different ways of enumerating immunologic signatures within the immune system using advanced technologies and so forth. And most importantly, because I don't want to scare people, most people who suffer from post-vaccination syndrome had pretty bad symptoms within the 10-day period after receiving their immunization. So I know a lot of people who have received immunizations for their work or to travel and so forth didn't have many symptoms. So you don't want to manifest or think negative thoughts or excessively worry about, oh my gosh, I did get a shot several years ago. Am I screwed? Please don't. This isn't a doom and gloom report. I have many people in my life who are perfectly healthy after receiving these things. But some people have symptoms still, right? So they have 42 participants that have been enrolled in this who have what's known as post-vaccination syndrome. And they have 22 healthy controls who also received the S protein-based immunization. And they looked at various aspects of the immune system. And here's essentially what they found is excessive fatigue reported in about 85% of these subjects, tingling and numbness in the hands, exercise intolerance, brain fog, 77%. I hear that a lot from individuals. Difficulty concentrating, falling asleep or staying asleep, neuropathy, muscle aches, anxiety, tinnitus, and burning sensations. Those were lower reported, but fatigue is a big one. Now, what I think is important about this is it turns out many human pathogens are ubiquitous, opportunistic, and capable of establishing lifelong infections with alternate latency and reactivation cycles, meaning that you can be exposed to a pathogen like cytomegalovirus or Epstein-Barr, or even have Lyme disease, and you can go through these periods of remission and reactivation. And it may be due to the nature of the mechanism of the S protein-based immunizations that the immune exhaustion or immune stress that could be induced as a consequence of receiving that immunization, that could alter the reactivation latency period of different pathogens that you've been exposed to, like Epstein-Barr, for example. I remember I went through a series of, I was really fatigued in my early 30s, and I went to a naturopathic doctor here in Washington, and that individual, we ruled out all sorts of hormone issues and things like that. I was just like really tired all the time. I was, a new father and things, but it turned out that I have antibodies to Epstein-Barr. And she was thinking that perhaps the stress of being a sole income, provider for a young family and so forth, and traveling a lot, could have led to this reactivation of a latent virus known as Epstein-Barr. And it turns out that in this study, they found that individuals who had this post-vaccination syndrome displayed immunologic evidence of an Epstein-Barr reactivation. And so that was, I think, quite interesting. So just something to consider. Now, why might that be? Why would getting one immunization cause another virus to sort of reactivate? Well, it could be due to the fact that the immune system is functionally exhausted, especially if people have had repeated immunizations. If we think about this, booster after booster and so forth of the same protein, it can lead to this functional exhaustion, which is where I want to get into this section right here. I just want to pause here and just say, I appreciate you being here. Because of the nature of this content, it's really important that you hit that like button and leave a comment so that people can actually see this video and the research we're about to display. Also important, friends, we got to focus on just basic health here. So things like vitamin D, vitamin K, vitamin A, creatine, all of those tools can be really helpful for just optimizing health, and especially if you do get any respiratory pathogen, to maximize your recovery time. So if you're looking to support your vitamin D levels with a really great form of vitamin K2 and vitamin A paired together in a synergistic combination, check out Myoscience. I'll put links in the description below, and you can use the code podcast at checkout. And so this is absolutely wild to me. The title of this paragraph is Increase in Circulating SARS-CoV-2 Spike Protein in Participants with Post-Vaccination Syndrome. The paragraph goes on to say that detectable S1 protein was found in participants' plasma ranging from 26 days to 709 days from the most recent known exposure. Do the math, 365 divided by 709. So we're talking about more than 2 years. Now, I don't know about you, but that was not fully disclosed when this was rolled out, that, hey, your body might be making this protein for over 2 years. That is absolutely wild. Remember, we were told that this is going to be broken down. You're going to make some protein. Your immune system is going to remember it so that if you're ever exposed to COVID, your immune system is going to have a head start, and then that's the end of it. You don't have to worry about the long-term side effects. Anyone who questions this is an anti-science conspiracy theorist. Well, we have evidence now that in some people, the S protein from a shot can be detected in their blood 709 days after immunization. So this is not to induce vaccine hesitancy or say that this happens in everyone, but I think this is an important point to understand, because if your body is making a protein that is non-native to you, it's only natural that your immune system is going to react to that. And over time, that can create some functional exhaustion, which it turns out is what the investigators talk about here. They talk about immunologic signatures and markers of immune exhaustion and immunosenescence. And that leads us back to the flu. So this is not occurring in everyone, my friends. I'm not trying to induce scare tactics or scare anyone here, but it turns out that some people are more susceptible than others to excessively make this S protein if they have received an mRNA immunization. And it could be that those people they have a more functionally exhausted immune system, and so are therefore more susceptible to a common pathogen such as influenza. And so going back to the hypothesis and the different scenarios as to why this cold and flu season appears to be more problematic compared to years past, that could be part of it, that some of the people that are getting really sick have a functionally exhausted immune system due to this excessive exposure to this antigen that causes a lot of immunologic shifts and functionally exhausted aspects of the immune system that I think hitherto hasn't really been discussed or thought about, because our public health apparatus and most mainstream doctors really like to avoid the elephant in the room. It seems that public health is really just black or white. You either eat saturated fat or you don't, right? If you eat saturated fat, you're increasing your risk of heart disease, right? You have to get your immunizations or you're a conspiracy theorist. There's no gray or there's no middle ground. It's sort of like everyone has to do everything or you're a quack. But I think we should be asking more critical questions and trying to figure out, why do some people make S protein and therefore have more of a functionally exhausted immune system over time compared to not. We should have asked more important questions, knowing that about 40% of infections were completely asymptomatic. For more than 80% of infections, even during the original outbreak, most of them were mild anyway. So we should have been, in my opinion, a little bit more selective with who we recommended receive this immunization, considering all those statistics. The infectious fatality rate was directly tethered to age. And so most working class individuals, the IFR was exceedingly low, less than the flu, but it did increase after the age of 50. So there should have been a little bit more of a nuanced conversation, in my opinion, back in 2021 and 2022 in particular. But now, as we Monday morning quarterback the situation, I think we can learn from this going forward. Should there be, a bird flu outbreak or what have you, we need to really look at public health through the lens of a more nuanced conversation. So I would like to know what you think in the comment section below. I've received a few DMs from people who say they do everything right and they got really sick, but most of the comments that I've seen, this is anecdotal, of course, in the internet, people say that everyone who was gung-ho about all the public health measures back in 2020 and 2021 are the very people that have gotten really, really sick from this year's cold and flu season. So let me know what you think in the comments. I think we all learn from the comments, so I would love to hear from you. I appreciate you watching all the way through. Thanks for hitting that like button. If you need some micronutrients like vitamin D, zinc, iodine, things like that, check out Myoscience and save with the code podcast, and we'll catch you on a future video down the road.